Have you ever wondered what Eliquis really does inside your body? Is it a life-saving medicine, or could it carry hidden risks? In this video, we will break down everything you need to know about Apixaban, also known as Eliquis. We'll explain how this medicine works and go through 7 major effects, both the benefits it offers and the side effects it may cause. Everything will be explained in simple, easy-to-understand terms, so by the end of this video, you'll have a clear picture of how Eliquis affects your body and why it is prescribed. 1. What is Eliquis and how it works? Eliquis, whose generic name is Apixaban, is a type of medicine known as a blood thinner or anticoagulant. That means its job isn't to make your blood thinner in the way you might think, but to stop dangerous clots from forming inside your blood vessels. It does this by blocking a key enzyme in the clotting process called factor XA. Factor XA plays a central role in making thrombin, which is a substance your body uses to turn liquid blood into a clot. By stopping factor XA, Eliquis lowers the amount of thrombin produced, so clots are less likely to form in arteries and veins. This is especially important in people with certain heart rhythm problems or after surgery, because clots in the wrong place can cause strokes, lung blockages, or other life-threatening issues. Once you take a dose, Eliquis is absorbed into your system within a few hours, and that's when it begins to work at reducing clotting activity inside your body. 2. Major benefit. Prevents dangerous clots. One of the biggest reasons people take Eliquis is to protect against dangerous blood clots. In people with atrial fibrillation, an irregular heartbeat, blood can pool and form clots inside the heart. If those clots break loose, they can travel to the brain and cause a stroke, sometimes a severe, life-changing stroke. Eliquis helps reduce that risk significantly by stopping clots before they form. It's also used to treat and prevent clots in the deep veins of the legs and in the lungs, PE, which can be fatal if not treated. In large clinical studies, Eliquis was shown to be at least as effective as older treatments in lowering the chance of another clot forming after someone has already had one. Because it works directly on the clotting process, it gives many patients a strong protective effect against these dangerous events when taken as prescribed. 3. Big benefit. Safer than older drugs compared to older anticoagulants like warfarin. Eliquis brings some major advantages that many doctors now prefer. Warfarin has been used for decades, but it requires frequent blood tests to measure how well it's working and whether the dose is right. This can be inconvenient and stressful for patients. Eliquis, on the other hand, has a more predictable effect, meaning most people do not need regular blood monitoring to check clotting levels. It also interacts with fewer foods and other medicines compared with warfarin, making it easier to manage daily life without worrying about diet or constant checkups. Clinical evidence shows that patients taking Eliquis have lower rates of major bleeding and stroke compared to those on warfarin, which is a key reason many healthcare professionals choose it now for long-term clot prevention. 4. Side effect. 1. Bleeding risk, most important. Even though Eliquis helps prevent clots, its strongest effect reducing how quickly blood clots also creates the biggest risk: bleeding. Because clotting is suppressed, it takes longer for the body to stop bleeding when injuries occur. This might start with something small like easy bruising, frequent nosebleeds, or gum bleeding, but it can sometimes develop into serious bleeding inside the body, in the stomach, into muscles, or even in the brain. If bleeding becomes heavy or doesn't stop, it can be life-threatening and needs immediate medical help. Because of this, doctors always tell patients to watch for signs of major bleeding and to tell their healthcare provider right away if they notice any unusual bleeding, blood in urine or stools, or very heavy bleeding after minor injuries. 5. Other common side effects. Aside from bleeding risks, there are other side effects that some people experience while taking Eliquis. A fairly common one is nausea, which might feel like mild stomach discomfort or feeling slightly unwell after eating. Another possible effect is anemia, which happens when blood loss is gradual or hidden. It can make a person feel tired, weak, or short of breath because their body doesn't have enough healthy red blood cells. There can also be minor bleeding signs, like easy bruising or blood appearing in urine. While these side effects tend to be less severe than major bleeding, they still require attention. If they persist or worsen over time, it's important to talk with your doctor or pharmacist so they can check what's causing the issue and whether any adjustments should be made to your treatment. 6. Rare but serious risks. In addition to common side effects, there are rare but serious risks associated with Eliquis that everyone should be aware of. One of these is the possibility of bleeding inside the spine after spinal procedures, which in very uncommon cases can lead to long-term nerve damage or paralysis if not treated quickly. There are also allergic reactions, such as swelling of the face, lips, or throat, hives, or difficulty breathing. These are medical emergencies and require immediate help. Because Eliquis affects clotting, combining it with other blood thinners or certain pain medications like NSAIDs can raise the risk of dangerous bleeding. These rare issues don't happen often, but they underscore the importance of taking Eliquis under strict medical supervision and reporting any unusual symptoms right away. 7. What happens if you stop it? Stopping Eliquis suddenly without your doctor's guidance can cause serious harm. Because the medicine quickly loses its effect when you stop taking it, your clotting risk can return to what it was before, or even become temporarily higher. This means you could suddenly be at increased danger of forming a new blood clot, stroke, or other thrombotic event. For this reason, medical professionals always recommend that patients never stop Eliquis on their own, especially if they are taking it for heart rhythm problems or after a clot. If there's a reason to discontinue the medicine like upcoming surgery or side effects, your doctor will usually switch you to another anticoagulant or plan a safer transition rather than leaving you unprotected. To wrap it up, Eliquis is a modern anticoagulant that works by blocking factor SA and reducing clot formation. It brings major benefits, including protection against stroke, DVT, and PE, and is often safer and easier to use than older drugs like warfarin. However, like all powerful medicines, it has side effects and risks, especially related to bleeding, and must be taken exactly as prescribed. Always talk to your healthcare provider if you have concerns, and never stop taking the medicine on your own. Share your thoughts or questions in the comments, and let us know what health topic you'd like to learn about next. If you found this video helpful, make sure to hit the like button and subscribe for more health guides. Don't forget to share your questions or experiences with Eliquis in the comments. We'd love to hear from you.